I'm glad you are here. On this channel, I break down the counseling tips for many of the most commonly prescribed medication, which is prescription and over the counter. Medications, I try to explain it in a way so that it's easy to understand and you benefit from that information. My goal is to help you learn about how these medications work, how to take them safely, the common side effects, and important precautions. And friends and family, the information which I'm going to share is for educational purposes only, and it's not a substitute for personalized medical advice. Always consult your healthcare provider or pharmacist before stopping, or changing any medication. And this information, this video which I'm making is in continuation of the previous video which I made for the ciprofloxacin, about the ciprofloxacin side effects. This medication, actually, I have seen it's the most commonly prescribed medication to treat infections, and especially the urinary tract infections. So I decided to talk on about that topic and to give you some of the counseling tips so that you can get the maximum benefit. So I have noticed that there are people who are taking lots of over-the-counter medications, and ciprofloxacin, if it's prescribed, then the most common, actually, what we do, the mistake is that we take all these medications together and avoid taking it's very important to avoid taking Cipro at the same time as antacids, like which are antacids are those medications which are used, which we take to treat acid reflux, acidity, and most of them, they have magnesium or aluminium, and some of the calcium supplements, iron and zinc supplements, and multivitamins, which are also combined with the minerals. So, how to? The question is that if we are taking it, then how to avoid this drug interaction? Do not take the mineral supplement or antacid at the same time as Cipro. What it does, it binds to the antibiotic and it prevents it from being absorbed. So take Cipro at least 2 hours before calcium, iron, magnesium, zinc, or aluminium containing supplements, or wait at least 6 hours if you already took those products. Before taking Cipro, I would advise, do not take with thick yogurt or cheese alone. However, it's okay if you are taking dairy products as a part of your full meal. So the commonly prescribed medications, these, it's a list. I just, there are lots of other interactions, but I only selected those medications which I see lots of people, lots of patients, they are on those medications. So we have to see how to avoid the interaction with ciprofloxacin if that's the prescribed medication. And first of all, like in the group is warfarin, which is a blood thinner. What happens? Warfarin may increase the bleeding risk if it's taken with ciprofloxacin. So in that case, INR may need the close monitoring. And there are a couple of diabetes medications, like for example, insulin, glipizide, glyburide. It may cause the blood sugar to become too low, or less commonly, maybe it can cause it to be high. So we need to be careful about the concurrent use of these medications together with Cipro. And the third one is heart rhythm medications. There are lots of people, the patients who are on amiodarone, sotalol, or other heart rhythm medication. So when we combine ciprofloxacin with these medications, it may increase the risk of the abnormal heart rhythm, which we, in medical terminology, we call it QT prolongation. And it is especially, this can happen in susceptible individuals who have a history of heart problem or pre-existing heart condition. So another very common, I have seen the medications which patients are on, they are steroids. And the most common steroids, they are prednisone, dexamethasone, prednisolone. So when they are taken together, they might increase the risk of tendon rupture or injury especially in the older adults. So if you see any signs of swelling in the tendons or any inflammation, just talk to the doctor. They might review this antibiotic, or they might suggest the alternative. And tizanidine is actually a muscle relaxant, and many patients, they are on muscle relaxant for some reason, and it can, when they are taken together, it can dramatically increase the tizanidine levels, which can cause excessive drowsiness and slow the heart rate, and blood pressure can be lowered. And this is especially very important if someone is actually going to work, or they are driving, so it's not safe in that case. And another interaction, it might have interaction with the methotrexate or clozapine. It can increase the clozapine levels and result in increase the side effects of the clozapine. So the last one is actually, I would consider it is very important, because most of the people, when they wake up, they just want the coffee or a tea as a part of their daily routine, just before starting any, before going to work or before doing anything, so that to be more active. So in that case, like when they are taken together, like coffee, tea, energy drinks, or caffeine containing medications, if they are taken with ciprofloxacin, so what happens that ciprofloxacin, it slows the breakdown of caffeine. And when it slows the breakdown of caffeine, it means that there are increased blood levels of this of caffeine, which may result in jitteriness, racing heart, insomnia. Insomnia is like, it affects sleep, and it can also lead to anxiety. So this combination, like taking at the same time, I would highly recommend to space it out a few hours apart from each other, at least 2 to 3 hours apart. So to summarize, like since many we all are on lots of the over the counter medication, taking supplements, so it's very important to tell your healthcare provider and your pharmacist about these medication, so that they can educate you about the drug interactions, and they can tell you that how to take it, and if there is any interaction, how to space it out, so that you can get the most out of it, and it helps in treating your infection. And do not take the mineral supplements or antacid at the same time as ciprofloxacin. And again, seek the medical attention promptly if you see any tendon rupture, or if there is any irregular heart rate, or any fainting, severe diarrhea, or any signs of allergic reaction. In this case, you need to contact your this is actually, you need to contact your provider and seek medical advice. These are some of the references which I use to go over the counseling tips. So again, just to emphasize, this video is for educational purposes only, and it does not replace the medical advice. Always follow your prescriber's instructions and consult your pharmacist or healthcare provider about your specific medication. So, friends and family, if you like my effort, if you like this video, if you learn anything which you think it will benefit you, so please subscribe, like, and share for more informative videos. And it's an encouragement for me to continue making those videos, to so that to just help you learn more about many new medication, and over the counter medications. And I would like to thank you for watching, and I hope that see you soon with another interesting and new video. Till then, stay blessed, stay healthy, be happy, and hope to see you soon then. Bye.